Hi, my name is Mike Heffernan. I'm a specialist dentist. We're looking to do some online free consultations to talk about different dental issues. If you have anything that you're concerned about, whether it be a treatment or something that's going on in your mouth that you would like to chat through, we would really welcome you contacting us at info@drhefs.com. And we look forward to speaking to you soon. So tell me, when did you first kind of either notice yourself, or when was the erosion side of things first picked up? What was the background?
I think I would have been about 40, 42 or something like that. And she said, I'm noticing a little bit of wear. You must be a grinder. And so she gave me a night guard because you don't want to like grind your veneers away. And so she gave me a night guard, and I've been wearing a night guard ever since then, but it has not resolved things. And every time I've gone to a dentist, they're going, "Are you grinding?" And I'm like, "No, I'm not. I'm wearing a night guard." And the erosion seems to continue its progression, and it's not like it's accelerating. It's just a steady state where it's now I really am worried about it becoming an issue, and I'm just very perplexed as to what might be the root cause. I mean, my diet is incredibly healthy. I never eat sugar. I don't drink. I don't drink any alcohol. I don't even drink coffee or tea. I just drink water, and I pretty much just subsist on a carnivore diet. And that's working great for me. My body composition's perfect. My energy levels are great.
Yep.
It's just this tooth issue, and so I don't drink. I don't eat any acidic foods. Citrus foods. I'm not sucking on lemons. So I'm mystified as to why this is occurring, and I don't. I just don't know what it could be. And I would like to obviously stop this from progressing any further. But there's quite a bit of damage that's already been done. And my current dentist really wants to put crowns on these teeth to protect them from any further acid or any further erosion, because he's worried that if it gets worse, then there's not going to be enough tooth structure to support crowns. The veneers have done a really good job at, eliminating any of the problems of tooth erosion for the veneered teeth.
How old are you now?
I'm about to turn 60.
Wow, you look good.
Thanks. Thanks.
So it
Yeah.
was picked up about 20 years ago.
Yeah. Yeah. I would. Yeah. That's when it was first noticed, and we all, put it down, or maybe I'm grinding my teeth.
Yeah. And
And
has
I don't.
anybody ever said that you actually grind your teeth? Has anybody noticed you grinding your teeth at night time?
No, I not really. And again, I've been wearing a night guard for ages.
Yeah.
Would supposedly stop that from happening.
And the night guard that you wear, I know you sent me through the guard that you kind of currently wear, but
Yeah,
the one that you've worn historically, is that one of the soft ones, or is that a really hard one?
it was a hard one.
Right. And did that fit in your up teeth or your lower teeth?
It was upper teeth.
Teeth. Okay. And so you wear a night guard, which is brilliant. I mean, one of the things that we find now, we used to kind of really think that grinding and damage through bruxism was all nighttime, but
Mm-hmm.
we also know actually there's a lot of people that clench and even grind their teeth during the day. I mean, you've got that big kind of like square
Right.
jaw and the
Yeah.
masseter muscles that look pretty solid there.
Right. Right. So I
And
think.
particularly if you're doing a lot of exercise as well, you might be doing a lot of clenching during the
Yeah.
day as well.
Well, I've worked out very hard my whole life. Intense. Physical training ever since I can ever remember.
Do you get any sensitivity in your teeth at all in the moment? At the moment,
Um, I I I don't really know. I have
hot,
not.
cold is fine.
Yeah, hot, cold is fine. And and even though I don't have any sensitivity, but I really believe that I noticed a difference when I've been sucking on those mints, on your
Really?
mints. Yeah, I mean, it just they just feel different. You know what I
Yeah.
mean? I don't know.
We've had a number of people say that anecdotally. And
Yeah,
I mean, if I think about the ingredients that are in there, particularly the calcium phosphate, that would help with sensitivity. But yeah,
yeah.
anecdotally, we've had that from other people as well. So that's really good to hear.
I'm intrigued too with the implementation of the green tea extract and things like that in there as well. There's a lot of things that happen with green tea.
Oh,
Does a
there is
lot.
a lot of things. Yeah. I mean,
Like, yeah.
I find it really hard to kind of limit the scope of what we talk
Right.
about with green
Yeah.
tea.
I
There's
mean,
so much.
yeah. There's so many potentially confounding factors, but
Yeah.
if they work, they work.
Yeah, that's right.
Yeah.
So coming back to your diet,
Hmm.
have you always been kind of cautious on what you're eating, or is that something that more
I
recent?
think ever since I was about 40, I think I've been very conscious with what I've been eating. I think, in my 20s and 30s, I was, eating just normal stuff, but I've always been very interested in health and fitness. And so I started getting more and more interested when I was around, 40 or so. And then I really cleaned things up. Even though I didn't feel any effects, I was never overweight. I never had any metabolic issues from diet or anything like that. But I've been very, very cognizant of what I eat, and obviously not eating sugar and things like
Yeah.
that. Yeah.
And you're mainly carnivore diet, but you obviously have to throw fruit and vegetables in there somehow. How are
Um,
you doing that?
yeah. Well, actually, I have not had any fruit and vegetables for months now.
And
Um,
what about nuts and kind of pulses and things like that? So,
I'm not having any of those things. Yeah. But again, before I was on a carnivore diet, my erosion was, you know, bad. And also, ever since going on a carnivore diet, I definitely feel like I think I remember having some tooth sensitivity when I would eat citrus and things like that, but now I don't have any.
okay.
Yeah. Yeah.
So, and medications wise, have you ever taken any medication?
I've never taken a medication in my life. Yeah. I think
You don't take any kind of vitamin supplements like that, or like vitamin
no,
C?
no, the only thing I take is magnesium threonate. I
Right.
take some magnesium threonate.
Does your mouth feel dry to you?
Not really. No, no. Um, I've never noticed that I have dry mouth.
I think you sound like, I mean, you kind of tick so many great boxes in terms of not having tooth erosion.
Right,
I mean, we think about tooth erosion as being either extrinsic acid, like what you diet, whether that be sodas, whether that be
right.
even
Yeah,
things like vitamin C, or at the extreme end of the kind of scale, people's occupations. But your occupation is not going to be a high risk. You're not in a battery acid or something,
no,
battery acid
no.
factory or anything like that.
Yeah,
So
exactly. Right,
you're not in any of those. Then we also sometimes think with like people who are kind of super fit, and they will use, they'll get dehydrated because they're on their bikes or whatever, running, or they're in
right.
swimming pools, and then they will drink acidic drinks with high sugar. But you're very conscious
Yeah,
about that. So I think if
just
we,
take water. Yeah,
yeah, so if we take away the diet, then the only other place that the acid can come from is intrinsic.
right,
And I know you kind of said that you're not aware of having reflux,
right.
gastric reflux. But do you ever wake up with kind of like or have a cough or a tickle in your throat, or kind of that bad taste in your mouth in the morning or anything?
Never. Yeah, never.
So
I know what acid reflux, the symptoms are,
yeah,
and I've never noticed that.
no,
That feeling like, I know when, like if I've been many years ago, if I ever felt nauseated and want to throw up, that
yeah,
feeling of, that taste you get,
no,
I never have that.
no, you never get that.
Yeah.
So I mean, the options I think you have is really to kind of, there's a couple of things that I would get you to do as kind of homework.
Sure.
The first thing I would say is to literally write down for a whole week, without trying to change your diet or do anything kind of weird or funky, write down everything that goes past your lips.
Right.
Whatever it might be.
Yep.
So just to kind of record what it is, and then we can have a look at that and see if there's anything there that looks like it, that you wouldn't anticipate. My bit of homework is to have a look and see what a high protein carnivore diet might do to your saliva, because I don't know the answer to that.
Right.
And I wonder what that might do to your saliva. But that, I don't think, is the thing that's caused your problem, because you've only been on that for a relatively recent time. But I would like to know the answer to that anyway, because I think it's an interesting kind of question to have. The next thing that you could do is, so I don't know if you can either ask your dentist, or if you can find a dentist, there is this, which is a product that's made by GC, which is a big Japanese company, and it's a salivary testing kit.
Okay.
Now, you're obviously a very astute, savvy person, and you could probably run this test yourself if you didn't want to get your dentist to do it, but you'd have to buy one of these.
Okay.
And I did a test with this a few years ago with Prosecco after a Christmas New Year, just to kind of see what Dr. Hefts does to our saliva. And actually I tested with one of these kits to show that it neutralizes the acids right away. But with this, it tests your resting saliva, it tests your stimulated saliva, and it tests to see how much production of saliva you have both at rest and stimulated. I should think you'll probably be in the normal range for both of that. But it also allows us to test the buffering capacity of your saliva. So if you were to have something acid, how good is that saliva at actually neutralizing that acid? And that is something I don't know for you. It would be really interesting to test that. But really, your dentist should be testing you on that.
Okay.
So that would be kind of interesting to see what your saliva is like. I think the next stage, if all of those boxes ticked fine, I think you've then really got to kind of consider, do you want to go and see a gastroenterologist and see if you suffer from silent reflux? So 25% of people who we see have really severe erosion, and we can't tick any of those other boxes, will have silent reflux. And you might be one of those people.
Right.
But I think before you start kind of chasing down gastroenterologists and everything else, I would kind of take the simple step first and see what your saliva is like and see if that's working.
Okay. Yeah, I mean, it's just, there's obviously, I can't imagine what could cause that erosion other than something that is acidic, right?
Yeah, absolutely. I think, so when we think about tooth surface loss, which is what you're suffering from, the most common thing is that there is an acidic element, but that is often combined with another element, whether that be grinding, so attrition, or abrasion. So if you were kind of grinding on kind of like clay and that. I mean, when I was in Iowa doing my specialist training there, we would see a lot of people with really worn down teeth, and it's because they were kind of farmers, they were out in the fields, and literally they were kicking up dust and it was just going into their mouth, and then they were just wearing their teeth down enormously.
Yep.
But I mean, certainly looking at the photos you sent through, when we're looking at kind of, well, there's another thing I should add, what you also, I should have checked. So historically, they kind of started to pick up that you had tooth surface loss.
Yeah.
One of the really nice things that we do now is that we can actually use a digital scanner inside your mouth, and actually we can measure over a time period and compare the same teeth over a time period and see kind of how much change there is. Now, historically, we used to take models of people's mouths, but it was really difficult to kind of look at it and go, because the amount of difference most people it's going to be so small you wouldn't really pick it up.
Yeah.
But another thing that you might want to do is see if your dentist has got an intraoral scanner and get them to scan your teeth. And then 6 months, a year later, get them to scan it again and see if this is ongoing or if this is, something that's historic.
Right.
To a certain extent, the photos that you sent through to me, I know you're kind of looking at them going, oh my God, my teeth are wearing away. They don't look too bad. Okay, so your teeth are not disappearing. You've got loads of tooth there to restore.
Yeah.
There are a number of different ways of going through that, kind of fixing that problem. So one is to do nothing. The consequences of doing nothing are that you might lose more tooth surface, you might get sensitivity, and it might be an aesthetic concern. But you're doing all the right things. Your kind of diet is good. You're using remineralizing agents to actually kind of help repair and maintain the tooth. And you're not getting any sensitivity. But it's not, the bits of photos that I could see didn't look like it was terrible from an aesthetic point of view. But that's relative to everybody.
Yeah.
If you wanted to actually do something about it and actually start to put it right, the first thing that we really should do is kind of work out where the problem's coming from. But we've talked about that, and there's some homework that we've both got to do on that.
Yeah.
The next approach is, what is the least damaging way to restore your teeth? Now, there is a bit of a divide between kind of philosophies, training, and approaches. And there's not, one wrong, one right way of doing it. You put crowns on teeth.
Yeah.
But when you put a crown on a tooth, you're taking away typically more tooth surface.
Right.
And somewhere between 10 to 20% of teeth that we crown then go on to have root canal treatment and go down a scenario where it's sometimes called the spiral of death, which sounds really dramatic, but it means that you're basically, taking away more of the tooth, and you're actually going to ensure that you will always need more dentistry forevermore.
Right.
At the other extreme end is to do nothing. And somewhere in between is, on the more anterior of your side teeth, you could put composite bonding on it, which is an additive approach. It's not taking away more tooth, and it's literally building up the tooth on it. The nice thing about that is it's additive. It's not destructive of your teeth. The biologic cost is really very low. It allows the dentist and you to assess kind of how much wear and tear you're putting on it.
Yep.
And you can always resurface it, repair it, come back to it.
Yep.
And I would say probably the more anterior canines and premolars, I would say I would put composite on there. The further back teeth, the molars, they're the ones that are taking a lot more of the occlusal load, the biting forces of your teeth. And composite may not be strong enough in those situations. Now, you could start out with composite. If that didn't work, you could always then revert to what we call an onlay, which is something that goes over the top of the tooth. And it's because you've got a good ring of enamel, the bonding approach that we have with a lot of our new materials is so much better that actually we don't need to drill the tooth down to get a crown to go over the top. We can kind of bond over the top of it.
Yep.
So you could do your back teeth in either, if you wanted to kind of go dentist and, the ultimate best material with kind of low wear against your opposing tooth, you could go gold. But there is obviously an aesthetic issue with that. But if you looked in a dentist's mouth and you were looking at the back of their mouth, they would probably have gold if they were going to do anything.
Right.
The alternative is something like a lithium disilicate, which is a ceramic which you can bond again to teeth very, very well. So there's a range of different options, but I would say if I was treating you, I would be looking at doing composite on your more anterior teeth and either lithium disilicate or gold at the back, without kind of doing a test run with composite beforehand.
Gotcha. Okay.
So I think there's a few approaches. The photos that you sent of your upper teeth. I couldn't see really, really clearly, but it did look to me like there was some erosion there as well.
Right.
And possibly all of this needs to be very carefully planned. And if you're going to increase the height of your bite, then really you need to be, I would say, be seeing a specialist like a prosthodontist to do that.
Mm-hmm.
And there are different camps in North America at the moment. Some of the very classic approaches, which is to put crowns and do a full mouth rehabilitation with crowns. Others coming out of where Pascal Magnier is teaching on the West Coast, they're looking at what they call biomimetic approaches to dentistry, which is trying to restore more with materials that are more similar to your own teeth, and in the functionality using composites and ceramics more.
I will do that homework where I mean, it's pretty easy because my diet is so simple.
But it's the simple things like hot water with a lemon in it that people kind of forget.
Yeah, yeah.
And I know you said you don't. I've raided our cupboard here for stuff. So the other ones are things like apple cider vinegar.
Yeah.
That's been a fad for a while. Even some very sort of like more ethnic kind of diets with rice vinegar, and then vitamin C, which is ascorbic acid. As well. So all of those are the ones that people don't really think about and can do it. I've had patients who've said to me that they get up in the night and they go and eat in the night. And I've had a lady come in and said, yes, she actually kind of sucks on Maltesers during the night. But I know that's not you. But you can get all sorts. So whatever's going past your lips, if you can record it, whether it be liquid or solid. And that actually, just while I think about it, what are you doing at home to look after your teeth? What's your kind of routine normally?
Well, I floss twice a day. So I don't floss aggressively. I only floss the teeth where I feel like there's some food stuck in between them. You know what I mean?
Yeah.
And so I will floss. And then I used to just brush with a little bit of baking soda. And because there's non-acidic, and then I'll brush my teeth gently with the Crest toothpaste that she recommended. And then after I've done that, then I go and I'll have one of your mints in my mouth, and I'll just keep it in my mouth and not swallow the saliva, but keep it in my mouth and just while I'm working. And then I'll have your mints, throughout the day. Like maybe I'll probably have 3 mints a day throughout the day. And I feel like they're wonderful, and I think that I feel that protocol seems to me to be a pretty good protocol to follow.
Right. Yeah, that's good. And do you use a manual toothbrush or electric toothbrush?
I use a manual toothbrush.
Right.
Yeah.
And when you have seen the dentist, have they ever said that you suffer from gum disease or anything like that?
No, I mean, sometimes there's a couple of pockets that are a little deeper than they would have liked here and there. But overall, my gums are okay. I don't have an issue. One thing that I've always remembered, my father, he had terrible problems with his gums and teeth his whole life. And he lost all his teeth when he was about 50. And he had real issues. And I just wonder whether there's some genetic component, that I inherited, and there's a lot of studies that have come out of you've had chronic health issues, dental issues and gum issues that it could really have some cardiac effects, So I've always been very cognizant of that.
Yeah. There is without a doubt an issue now with inflammation, and people have so long been kind of ignoring the gum side of things and just going, it's just my mouth, it's just my gums.
Right.
I mean, I think we're way worse in the UK for that than North America. It's always been kind of like a low kind of worry issue, is just like teeth. But that is a concern, and certainly keeping on top of your gum health is very, very important.
Yeah.
I mean, I always think now that actually seeing the hygienist is more important than seeing the dentist, because
Right.
actually they help motivate people. They're much better at communicating than most dentists about
Yep.
diet, and actually that the importance of all of this is what you do at home. I mean, the dentist and hygienist you might see every 3 or 6 months, but
Yep.
if you're kind of trashing your teeth in between, there's nothing that a dentist or a
Right.
hygienist can do.
Exactly. Exactly. Yeah. No, and I'm 100% committed to my oral health, and I've been really trying to watch it, and trying to do all the right things. And but I'm going to write down everything that passes through my lips,
Yeah,
and then and do you think it's a good thing for me to stick with that protocol?
I think if we think about our mouth, we really want to kind of create and encourage the good bacteria that we have in our mouth.
Yes.
It's our
Right.
oral microbiome. So we want to kind of push that microbiome favorably. For the majority of people, because of the diet that we have, we tend to eat things that don't encourage those positive bacteria. We tend to build up sticky plaque that
Yeah.
actually, when you look at the science, mouthwashes for the most part cannot penetrate that
Hmm.
biofilm to actually make a difference.
Yeah.
So to me, the really important thing is just once a day, if needs be, as long as it's done really well, is really good brushing your teeth and using something to clean in between your teeth. Because when you brush your teeth, you do the outside, the inside, the
Yeah.
tops of the teeth, but you're not doing that 360 degrees clean. If you're disturbing the plaque between your teeth once every 24 hours, your good bacteria can re-inhabit the,
Right.
the tooth. Now, the mints, to me, work on the tooth itself, but it also works on the bacteria, the free-floating bacteria that's in your mouth and on your tongue and everything else. And if you don't brush your teeth, what happens is over a 24-hour period, your good bacteria get over competed by the kind of the more harmful bacteria because of the environment in that biofilm.
Yeah.
And then by cleaning your teeth, you then have got to clean again, and your healthy bacteria in your mouth, floating in your mouth, land on your tooth and actually form what we call an acquired pellicle, which is a protein layer on the outside of the tooth itself. And that is actually the first protective layer. So we often think of teeth as enamel and roots, dentine, but actually
Yeah.
this protein layer is really important. So to me, mouthwash, I think mouthwash is fine if you feel like you've got bad breath and you want to have a kind of a shot of mouthwash to freshen your mouth. In some people who have got really dry mouth, I think a fluoride mouthwash is really useful. For the vast majority of everybody else, spending your time doing a really good clean,
Yep.
I think would be enough. And actually, one of my colleagues, he uses this term. It's a bit like trying to wash your car by throwing a bucket of water over it. You know,
Right.
you've got to get in and clean it.
Well, I'll do that. The protocol I'll do is just a good cleaning twice a day with a fluoride toothpaste, and then I'll follow that up with your mints.
Yep, I think that's absolutely great. And doing what you're doing in between, just with the floss, just
Yeah.
so you're actually just putting it on the surface of each tooth. You
Yep.
don't have to do it aggressively, and you're doing
Oh,
everything vertically
yep.
up and down.
Yep. Yep. Yep.
And that way you're cleaning all the way around your teeth there.
Yes. Yes.
And I think, I mean, I couldn't think of anything else that I was gonna kind of add,
Okay.
but I think it'd be fascinating when you've done that chart. If you want to send it through to me,
I
let's
will.
look at that, and I will have a look and see if I can see anything on what kind of a pure protein meat diet might do to the saliva. Not that, as I said, I don't think
Right.
it's your cause, but it'd be interesting to see just out of how that might have an impact as well.
Okay. And then I will also order that kit from that company, the
Yeah,
saliva, and I will do that test.
yeah,
And and I might just, figure out if that comes out normal, then maybe I don't see any reason not to contact a gastroenterologist and see what's involved in this silent reflux test.
Yeah. Yeah. I think it'd be fascinating to find out
That would be really interesting to find out. Yeah.
going forward.
Yeah.
But I also wanted to just kind of reiterate, I don't think that I would be too worried about where you are at right now,
Right.
restoring your teeth. I don't think you need to rush into doing something. I think you will need to do something, but it doesn't need to be now, or you're going to lose all your teeth and you're going to be in terrible trouble.
Right. Okay. That sounds good. And I also do really like the idea of investigating this whole biomimetic dentistry, restorations, and things like that. You know, the less invasive, adding things versus subtracting things is always better.
Yeah, absolutely. Definitely. Brilliant. Excellent.
Great. Thank you so much, Michael. I so appreciate your time.
My patients are really good at brushing their teeth morning and night time, but throughout the day, that's when tooth decay and tooth erosion happens. And that's why we created Dr. Hef's Remarkable Mints, because they actually neutralize the acids within 30 seconds of taking them. That way you're repairing your teeth on the go during the day. Very simple, tastes great.